Let me start first with introductions. As you can see, there's three of us here. If you're on the phone on audio only, we still are the same three that are here. We have to my right Kim Roberson, who has been at TPA for a long time. He's the Director of Pharmacy Practice. And then to my left, Justin Hudman, who many of you have met. He is the Senior Director for Public Policy here at TPA. And I'm Joe DaSilva, the CEO here. And what we really want to do is to have a conversation with you and to talk mostly about how some of the legislation is going to either change or improve your life as a pharmacist. What we want to do first is to talk a little bit about the logistics. You will be able to, if you are on GoToMeetings, you'll be able to type your question at any time. We will be answering the questions at the end of near the end of the program. If you are on just a mobile phone or just listening to it in some way, we will have an opportunity to take any text questions that you have. So feel free to text the number that was on your invitation. We also want to spend a little bit of time giving you some general background. As you can tell from the agenda, we're going to talk a little bit about the politics, about the changes that took place during the session, and certainly some of the end results on a more global, in a more global way. And then we'll get to the specifics. We really want to be able to share what happened and how it impacts you to the best of our ability. If it's not adequately covered for you, and if you have any questions, at the bottom of the alert that you received, you have Justin's and my phone number. Feel free to call. So with that, let me give a little bit of a background as to what happened this session. As you know, there have continued to be a lot of changes in government and who's representing us and who's leading us. And that's an issue that all of the different organizations that represent pharmacy have had to deal with. And as I bring that up, I want to acknowledge the great work from 6 or 7 other organizations that represent pharmacy. Many of you are members of TPA as well as those organizations. They were instrumental in the success that we were able to bring about, and instrumental in keeping some problematic issues off the table. So I know I speak on behalf of both of my colleagues. We really want to thank you for the contributions you've made, and most especially for the efforts of approaching these issues in a united fashion. That's key for us to be able to be successful representing pharmacy, is for us to be united. And so hats off to all of you. But as I was saying about the changes, this is one of the first sessions out of maybe, I've been doing this for maybe 17 or 18 sessions. This is the first session that I can recall such a massive change in leadership that impacts healthcare. Because we're not only talking about Governor Abbott replacing Governor Perry, we're also talking about having a new Lieutenant Governor in Dan Patrick. We're talking about having new committee chairs, both in the House and in the Senate, in terms of those that deal with healthcare. Some with a lot of experience, some without. So when you have that mix, and you have such a conservative group of individuals that were elected to primarily not increase any expenses, to stay within the taxes that they would receive, it was a little different kind of session. Not necessarily connected to that, interestingly enough, there were more bills filed this session. There were about 300 more bills filed than there were that were filed a session ago. Now, the rate of those bills passing is about the same. It seems like it's fairly frequent in the 20% range of the bills that get filed versus the bills that actually get passed. And as you may know, as you can certainly presume from that kind of data, it is a lot easier to kill a bill, to stop something from happening, than to actually make something happen. And that's a really good segue to what we're going to talk about in a little while, how we were able to generally have a session that did not cause any negative impact to pharmacy. In some areas, it actually was, there were some home runs, but there were, I would say, no strikeouts. Maybe we got hit with the ball a couple of times, but it was a productive session, as you will hear. And again, that thanks goes to not only those organizations, but to so many of you. I'm so pleased to see the numbers that have decided to take the time and tune into this particular presentation. We appreciate you taking that time, but we also appreciate you taking the time that you did during the session. The fact that our grassroots were as strong as ever before. Your involvement was stronger than before. You have probably, we were blessed with, I'd say even in the hundreds of people that took the time to officially voice their position on issues. And probably a good 30 to 50 different individuals that took the time to stay here and testify. And that may sound like, okay, well, I'd be a little nervous if I had to testify. But it's not just the discussions that you have with elected officials during a hearing. It's the fact that in many cases, some of you that came to the Capitol, you didn't know when it was going to happen. You were told 8 o'clock on a particular day, but in many cases in one case it was actually 3 o'clock in the morning the following day. But you stuck through. And so let me stop there and shift it over to Justin. He's going to give a little bit more the political perspective, and before we start actually handling the bills.
Thank you, Joe. It was an interesting session. As Joe talked about, we had a massive shift in the makeup. We had all of our statewides were up for grabs, which of course opened the door for lots of House members and senators to seek those higher level offices. With Lieutenant Governor Patrick, he came in, there was a lot of concern initially. A lot of folks expressed some angst over how the House and the Senate would get along. And I'm happy to report it actually went really well. Lieutenant Governor Patrick, I think his experience in the Senate paid a lot of dividends for how he ran it. It sounds like there were some hiccups, but that always happens in any new venture. But the House and the Senate were able to come together on a number of key issues that were important to the state of Texas and important to different groups, and come up with deals and come up with compromises, which is often the legislative process in Texas. When you have a Senate and a House, you've got to work together, and they always definitely remember that towards the second half of session when each other's bills are in each other's chambers.
That's right.
So it was a good session all in all. A lot of folks have talked about it not being a greatly big session, that there was no major events. We didn't have a massive budget shortfall. We didn't have a lot of the challenges that we've had in past sessions. But I would say it was actually a great session in that we continue to move the ball forward on issues. For many, sometimes not forward enough, but they're continually moving in that direction. And we actually passed this session a $209 billion budget. That's billion with the B, which covers all of our state programs, interests, school, education, health services, Medicaid, Medicare issues. These are things that were important to the state. A lot of people feel like some of these things weren't funded to the levels that they would like. I know from my experience, having been a staffer, that is literally probably the most difficult thing that the legislature deals with. That every cent is a challenge to place. because there are so many competing interests and individuals in need of those funds. I had the pleasure or displeasure, depending on your perception, of living through the 2011 budget shortfall, when there was far less funds to spend than we had this go around, but so many needy programs that needed those dollars. And it raised many challenges, even that we're still dealing with in pharmacy today from some of those budget changes. I want to give y'all some of the highlights of the budget that were, I think, helpful and important for y'all to know. And one of those is the fact that we passed a $3.8 billion tax break. That is going to be a $10,000 increase in the exemption for homesteads under your school taxes. So it's going to go from about $15,000 to $25,000. The numbers I've heard was it'll be a couple of $100s to the individual homes. The big one, and the one that's going to impact a lot of our folks listening, is going to be the franchise tax. There's a 25% reduction in the franchise tax. That's big. It's a quarter of your taxes are going to be reduced. I think there's a lot of hope that will ripple out into the economy, that there'll be a lot of increases in funding for people's businesses, that they'll put them back into the business and everything. It's a big step, almost a $4 billion tax break for Texans. It was big for the leadership coming in this session to do that. There was a lot of sense early on that would be one of those things that derailed the session, that would lead the House and the Senate to split ways and would ripple out into the budget overall. But they managed to come up with an agreement and actually get Texans some breaks, and that's a needed thing for a lot of Texans out there that are continually working hard, paying their bills, paying their responsibilities off, and now that's one less tax that they're going to have to deal with. The other one that they're going to highlight a lot, and a lot of you are going to be hearing about, is going to be an $800 million, that's $1 million, for border security. This is the hope and attempt to get the state guard folks off the border and transition DPS into a full-time role into securing the border. For a lot of folks, and I've heard a lot of statements made by some of the leadership folks, that the importance of this is because of the ripple effects that having a porous border have, that it increases expenditures on a lot of our other state programs. You're going to hear a lot of debate over the next couple of weeks or so of whether this was a good investment or not. At the end of the day, it is what it is. The legislature passed it, and there's going to be $800 million going into increasing DPS's role on the state border with Mexico. Another key one that I wanted to share with y'all is public school funding. As many of y'all know, the school finance has been in litigation for a number of years now. It's currently sitting before the state Supreme Court. The state ended up in this budget increasing the funds to public schools by $1.5 billion above what is needed. Now, this does not end the debate on whether or not the state has funded public schools adequately or not. We still fully expect the Supreme Court to make a ruling, and the legislature will later act on that decision. It could be a session, as in previous rulings, where the state has to come back and have a number of special sessions to address school funding if the court declares that the state has underfunded it or inappropriately funded. But at least at this time, there's a $1.5 billion increase to public education over last year. There's also a $1.3 billion increase on transportation. Now, this was largely found in removing some of the diversions. A lot of folks don't realize, or haven't realized for many years, that when you pay your taxes at the pump, that is not solely going to your roads. There was a lot of different diversions that have been created over the years to fund multiple programs, including some funding towards DPS and other state agencies that have tapped into that gas tax. So there's some diversions ended there, and in doing so, they say it will direct about $1.3 billion to our state roads. They are much needed in many parts of the state. I know I've had the experience down in the coastal area with the Eagle Ford. It's a great boom for Texas, but it is destroying roads. Those big rigs are just ripping to pieces a lot of county roads. So these funds will go a long way to helping improve statewide road conditions.
And if you take what Justin just shared with you, a billion and a half here, 800 million there, 2 point something billion there, all kinds of growth, which is the reason that the state budget is as large as it's ever been. Absent on that list were additional dollars for healthcare. Other than the continued growth of the Medicaid program, there weren't fees added on for pharmacy. There weren't additional dollars put in play for hospitals, and I think the only healthcare funds that were put in place were really focused on the lack of care, dealing with reductions in the number of general practitioners, pediatricians, and so forth, and some incentives there for schools to grow in the graduation rate of those specialties, and also for relocation in areas that are underserved. So it was a tough challenge, but I would quote my colleague over here again when he said the ball was pushed down the road. The concerns about Medicaid funding specifically for pharmacy did get punted down the road a little bit more. There's a little more sensitivity. There is a little bit more, we're closer in line to the bank teller. That doesn't help you at all, but it does help us prepare for opportunities that will come in the future.
There were a lot of steps laid this session that I think will pay dividends down the road. From some of the other organizations, did a lot of work with appropriations to try to seek some dispensing increases and some things that didn't unfortunately bear the fruit quite like we were hopeful for this session. But I think that they laid a lot of groundwork that will be helpful to pharmacy in the coming sessions as we continually share the message of pharmacy and the decrease in Medicaid funding that's resulted in a lot of pharmacists through the MCOs having a lot of challenges today. I did want to note there was the one key highlight on Medicaid that they're really highlighting and putting out in the leadership's press releases was a $373 million Medicaid cost containment savings. So this is to limit the costs. So their focus is to try to decrease how much funds are going into Medicaid through improving the care. That hopefully down the road, we've done a lot of work. TPA has led the way on MTM in Texas as a great cost containment to Medicaid. When you get pharmacists involved, it greatly increases the outcomes for the patient and ultimately decreases the cost of care. And that's something that we've continually shared that message, along with some other organizations have shared that message with HHSC, and we will continue to do so.
Keep in mind that the issues that we're getting into now, the legislative issues, almost all of them become effective September 1st. So nothing will be in place at least until September 1st. Many of them, if not a very high majority of them, will require some type of agency rulemaking, especially those that need a little bit more in terms of the parameters for the process that the bill or the law now will force.
Well, and that leads us on to talking about some of the big key issues, and that is a highly debatable term as to whether or not these were key issues for the state. But they were made key issues by both leadership and by a lot of public input out there. The first is open carry, and I want to tell you why it's important for you as pharmacists to start thinking about the open carry bill. As Joe mentioned, a lot of things start becoming effective September. This is one that won't fully be more in effect until January 1st of 2016. But when that happens, you're going to see a lot of people around the state who have been carrying concealed for many, many years in some cases are going to start openly carrying their firearms as will be allowed by the law, as is expected. That all indicators, Governor Abbott has said he will sign any type of legislation like this that comes to his desk. So we're going to talk as if it's passed, because no sense that it will not be signed by the governor. This is one that when it happens, you need to be aware that people will start carrying. There was a lot of discussion towards the latter half of session revolving around investigatory stops. Whether or not law enforcement can stop an individual to inquire whether or not they have a license. Ultimately, there was an amendment that said that law enforcement could not stop solely for that purpose. It was actually taken off in conference between the House and Senate when they disagreed on the bill. The reason I bring that up is that there's going to be a lot of folks that will be carrying as licensed. There are concerns by law enforcement and some groups that there will also be those that will be trying to carry that are not licensed. The reason it's important to you and your pharmacy, though, is starting to get yourself, your staff, people that work around you, knowledgeable about the fact that this transition will happen. I predict that you're going to see a large number of folks in the first month or two that'll carry, because they'll now have that privilege to do so. So you're going to see an increase. The important thing, though, is to note that there is now a new sign. Some of you are aware that for a long while now, under the concealed laws, there is a sign that is often referred to as the 30-06 sign. This sign is placed on by a business. It has to be a very specific sign as outlined in statute, which can lawfully prohibit an individual with the CHL from carrying in your place of business. They've now created, because of the open carry, what is going to be the 30-07 sign. This sign is going to be very similar to the 30-06. The difference is that it's going to outline that an individual is not allowed to carry openly within your business. And that's going to be important, because if you have a position that you don't feel like you want someone openly carrying, you're going to need to get this sign placed up when the law goes into effect. And again, it has to be a very specific sign. There's a statutory outline that defines exactly how the sign must look, the words it must say. But if you choose to put up a 30-07, please know that if you do not put up a 30-06 sign, individuals will still have the ability to carry concealed in your place of business. There's going to be a lot of folks out there that take that position, that they're comfortable with concealed carry. Their patrons don't know, they don't know. They're going to be fine with that. So that they'll put up a 30-07 and limit open carry, but not limit concealed. And then you're going to have some businesses that are going to limit both. It's going to be an interesting time. There's a lot of people that have talked about the Wild West that's probably about to happen. For those that follow these type of issues, it's pretty funny, because it's the same thing that was said when concealed carry happened the first time. And thankfully that proved to be an inaccurate assessment. I think the public's just going to need to get comfortable with this.
And certainly many of you have guns in your establishments for protection and for security, and this could impact some reconsideration of the security measures that you have. But we'll move on now to true pharmacy issues. And I think, Kim, you got the first issue. Oh, I'm sorry. There's also a campus carry.
Yeah, which I think our students are going to find interesting. So I wanted to make sure to mention this one. In the latter days of session, the legislature did pass a campus carry bill. It was modified quite significantly at the tail end of session, and now the different schools will have the ability to individualize whether or not they will have some level of carry on campus. It'll go to the student body, to the faculty, and folks within the community of the college to determine what level there will be as far as allowing the ability to campus carry or not, or to carry within a campus. This one has a much later effective date than open carry. We're more looking like once the presiding officers of the university establish rules, go through their processes. The rules must be in place no later than August 2017. So we've got some time, nearly 2 years and a legislative session before anything happens. Some universities may take steps much sooner and implement more rules much sooner. There's still going to be a lot to figure out about how this is fully going to work, but thought it was important for students out there that are listening to know that there was a bill passed. There is going to be some level of ability of licensed gun holders to carry on campus solely concealed. Open carry does not and will not apply to a university campus.
So, like you said, Back to the Future. We now can pack our guns and spit on the streets once again. Yeah.
Okay. Let's move on into the provider initiative and discuss that a little bit. As you know, TPA has been very involved in trying to get the provider initiative going this year. We've had some definite successes fed into by the success of the MTM pilot program that Justin mentioned. That particular pilot program with HHSC started in 2011. It's just recently finished up, and we're getting ready to publish the results of that. Both the hypertension phase and the asthma phase worked out very, very well, and that is going to be driving some activity through HHSC starting in the September timeframe. All of that is due to some efforts that TPA put together back in the 2010-2011 timeframe, where we formed a MTM work group to sit and talk about what it would take to get pharmacists recognized. And this work group created a pharmacist initiative, a recognition initiative. And it had three parts to it. First of it was to guarantee that pharmacists were recognized by the statutes in Texas as a healthcare provider. It also went on to talk about statewide protocols and having the pharmacist have the capabilities of dispensing certain items that would be handled under a protocol that was issued at state level. And then the third area was payment for services. Texas is blessed that over the years pharmacists have been and continue to be recognized as healthcare providers everywhere they need to be. Now that is different than what's going on nationally. There is a huge movement, as you all know, about the pharmacist provider status. A lot of activity, a lot of visibility, a lot of calls for action to get pharmacists recognized as a provider for the Medicare Part B funds, B as in boy. That is separate and apart from Texas, and in Texas pharmacists are recognized as healthcare providers. So our role this year in the session was to try and make sure that that was recognized and very plainly stated, so that we could begin working with insurance companies, employers, etc., to start to make pharmacist services more visible and get payment and compensation for those. The statewide protocol concept was driven also by that same work group. And the protocol, I'll read the comment out of the report that the work group made, is that TPA shall propose legislation authorizing the Texas State Board of Pharmacy to develop rules that would create a process for joint development of delegated statewide protocols by TSBP and the Medical Board. TPA envisions the creation of a statewide panel of physicians and pharmacists to develop protocols which all pharmacists could function. And these were going to involve different areas and types of drug therapy so that the pharmacists could manage those drug therapies. There'd be areas, categories, such as prescription nicotine replacement therapy, where a patient could come into a pharmacy, pharmacist could dispense it without needing to have a physician see the patient first. We also looked at having the CDC recommended immunizations go down to age 7 and stopping it instead of stopping at age 14. Travel medications didn't require a diagnosis. Subcutaneous epinephrine, naloxone, flu administration, strep throat screening, and administration of antibiotic therapies, and then also self-administered hormonal contraceptives to adults. All of those were part of what the work group put together as a stance, and we did have several bills that Justin will discuss later that became part of this overall provider initiative that TPA put together. A lot of good groundwork was laid this session, and I think 2017 is going to end up having some real good advancement so far as how the profession is viewed by not only other healthcare providers, but in addition the public, insofar as the services that they can obtain from pharmacists. So with that, Justin, I'll turn it over to you to talk about the dispensing.
Yeah, well, real quick, I want to give you all a quick update on House Bill 3146. That was the bill that Kim referenced to, that was looking to get it clearly you recognized as a pharmacist, as a healthcare provider. We let folks know early on that this really wasn't going to change anything. More than not, this was a bill about clarification, about really kind of putting your stamp out there as a healthcare provider. As Kim mentioned, the state's been great in many sections of statutes where healthcare provider is defined, pharmacists are included. Unfortunately, as Joe mentioned, a lot of bills don't tend to pass, and this one hit some very early on roadblocks, from challenges of finding someone even willing to file the bill. There were some questions on its relevance. Why is it needed if it's not changing any law? We recognize them today. Why do we need to file and pass a bill? To some potential concerns, I think, by some groups out there as to whether or not what was the long-term play on this. So it unfortunately met some early on challenges and failed to even get into hearing set. We plan to continue to move this ball forward and hope that we will see brighter futures on this subject next session.
I think that maybe to put this in context of how things work in the legislature, this is a good example that connects back with the physician dispensing. Physician dispensing, in the eyes of many, was a scope creep. Not the kind of creep you're thinking about, but just a general little step toward us taking some of the responsibilities from the docs. And that's what we're trying to do on this side. On the physician dispensing side, there was a feeling that there was a creep into our scope. And so you very enthusiastically opposed it, got a veto last session, got it to not even make it to the governor's desk this session. But that's where all this play is. And Justin's going to cover some specific issues that are going right in that gray line of whether this is a true scope issue or just focusing on patient care, access, and quality.
Well, and as Joe mentioned, the physician dispensing, thank you to all of you that heard our calls to action. You made a massive difference in helping me to do my job in the Capitol for you, as well as the other organizations. On top of that, we also had our organizations worked great together to really battle this issue. It had more legs during session than we had hoped it would. We managed to get it defeated early on in the Senate by getting it left pending in committee. On the House side, it unfortunately made it out of the Committee of Public Health, but was left pending in the Calendars Committee, thanks to a lot of work by folks like yourselves communicating with everyone. But then again, it made its little bit of a revival a week ago when you all saw an alert asking you to contact that it was placed onto a very important bill that would have been a challenge to request a veto on. But thanks to your outcries to the legislators, to the other pharmacy organizations, we were able to get that stripped off the bill, and it went up on a vote and had no opposition to removing that amendment from the bill. So I think that's a testament to everything that y'all did. So again, thank y'all. Want to touch on one that's getting some more recent press coverage out there, and it's the cannabis oil. Texas has just had signed into law by Governor Abbott the ability for a dispensary to organize, to be able to grow, produce, and dispense low THC oil. These are for specific use for individuals with epilepsy that has been extremely challenging to solve with other drug medications. Governor Abbott was very clear in his signing of it and his opening statements that this is not a leeway into medical marijuana being able to come into play in the near future, as well as definitely not recreational. This is a very, very limited purpose bill. There's some highlights on it because as the bill was drafted, pharmacists aren't a part of the dispensing part of it. And there's a lot of questions within the profession and a lot of, I think, attorneys out there posing a lot of questions on it being good that pharmacy at this time is not involved because it's still illegal on the federal level. And pharmacies would be placed in a very awkward position to potentially be dispensing something that was produced from a marijuana plant with very low THC. We expect a lot more information to come in the coming months on this as this continually is discussed, and we get a lot more input and from folks, but it's an interesting step that the state has taken today. The next one that we want to cover is those expanded scope dispensing type issues. As Kim kind of alluded to, we looked at some issues under our statewide protocol that really are more an increase of dispensing than it really was going to be an increase of prescriptive authority. Now, with that, pharmacists would have needed the ability and authority to prescribe because there's a handful of drugs out there currently today that, of course, require a prescription but ultimately don't require a diagnosis. Kim did a lot of work early on talking about where pharmacists are best served inside the healthcare scheme. And pharmacists really play a vital part in the treatment end. And those issues that we looked at raised some interesting discussions within the healthcare, the pharmacy profession, particularly from a few groups, or one group in particular. And this is something, though, that we'd love to hear from y'all about. What do you think about that panel concept? How does that work in your mind? Is that something that you see valuable? With that, we also will be working in the interim with TMA to have some of these types of discussions to figure out where these roles of pharmacy and physicians that have some of this interplay, where's there some room to work? Where's there some room for pharmacists to step in and play a larger role in the outcomes of patients, where we know they can, where we know you can better help manage some of these healthcare conditions that folks are facing, particularly the chronic conditions, that it's a lot of drug management that you have unique and expertise on and bring a lot of value.
Yeah, it's like a three-legged stool. I'm sorry to interrupt you as I usually do. Usually, I'm sorry, that's what I meant. It's a three-legged stool. When you talk about the patient and the quality of the care, then you have accessibility as a second leg. So in an attempt to expand the dispensing or expand some of these services, you have that second leg of greater access. But then you have the third leg, and that's payment. And the third leg is still quite a ways away. We will be working with insurance companies during this interim to look at ideas of how we could maybe even have a pilot for certain services that pharmacists are able to do right now under their license and get a payment mechanism in place that would compensate for your efforts.
We'll move on to the pharmacy practice issues. The first up is biosimilars. As I'm sure some of y'all remember, they have much longer memory spans than some folks. That last session, this was highly opposed by pharmacy, particularly with the notification inclusion. Through a lot of discussions during this session between the other pharmacy organizations, the bill sponsor, pharmaceutical companies, we worked closely with our other organizations. TPA was very proud to be the lead on this issue. and we worked very closely with our other organizations through the process, and we're able to successfully negotiate a bill that will give you the authority to substitute a biosimilar for a drug that has been approved by the FDA as an equivalent to the bio drug. That is probably not going to be a super big deal in the coming years, as we just currently have one that's been approved by the FDA, but it's not interchangeable at this time. We do expect, though, as the years go on, there'll be more and more of these drugs that will come on, and pharmacy will need this authority. Now, during a 4-year span, there was a 4-year sunset on this provision within the bill. It's on notification. Pharmacists will be required to notify when they've made these substitutions. Again, that's with a 4-year sunset, and the vast majority of these notifications will occur when you adjudicate your claims. We don't anticipate or expect any substantial increase in workflow. That's what a lot of the negotiations worked around, were to try to make them work within your systems today that don't require you to take additional steps to get that information to the prescriber. It's a good step for pharmacy to be able to get you that authority that'll be very crucial in the coming decades, as we see very clear indicators that biosimilars will be very much like generics in the long run and have a substantial role in patient care.
And there also is a movement within the FDA to reschedule the insulin products into the biosimilar category. So as those actions continue on, with some of it, I believe, Justin, is 2020.
I believe that's correct.
Forecasted date, where the insulins are forecasted to transition to the biosimilar category. As those take over, then this bill, as well as other activities that will occur between now and then, will impact reporting mechanisms and all sorts of different things that will be required at that point.
Now, the next one up is one of the bills that TPA led this session, and it's the epinephrine auto-injector. For those of you that may not know, this will give you the authority in an emergency situation to administer epinephrine auto-injector to an individual suffering from shock, anaphylactic shock. This was an important bill to TPA because it really signified the direction that we thought was valuable, and that's putting patients first. That's putting patient safety to the top priority of where pharmacists can be a great advocate within their communities. We heard a very personal story from our current president, Charlotte Weller, involving her 6-year-old son that had an experience that thank goodness a pharmacist violated their license and administered an epinephrine to her son and truly saved his life. To a lot of other folks out there that have done this over the years, but often at the risk of potentially exposing yourself to not only the loss of your license but litigation. This bill has been sent to the governor. Some brief discussions with some of the governor's staff. Haven't got any indicators of any concern. We really expect the governor to sign this, and if not, to just pass it without a signature, allow it to go into law.
And this gives you the liability protection should you be in a situation where you do need to dispense and administer. The next issue is a pretty quick issue. We've been talking about immunization, expansion of immunization now for at least 3 sessions. And the bottom line is that this, in the eyes of pediatrician, is a scope issue. It is their last opportunity. If you lower the age, they will no longer have the opportunity of that almost final wellness check of the child. We met during the interim last year with physician groups, probably 3 or 4 times. Some of those meetings were with a number of pharmacy representatives, and the answer was crystal clear: no. And so it is an issue that we'll continue to have under consideration. But we also have picked up a lot of pushback from pharmacists that are not that excited about having a much younger client base and administering immunization products.
And that takes us to the med synchronization. This was one that we had such overwhelming support by a lot of our students and other pharmacists that were here in Austin for our symposium. Got overwhelming support, had 112 people put in favor, I believe was the count. It unfortunately had some challenges getting out of the committee. There was some folks that worked, I think, behind the scenes to really slow this one down. And sadly didn't make it to the calendars committee in time to get a good placement on the calendar, and ultimately didn't end up making it through the legislative process. This is one that would have given you the ability to be paid for filling a partial script on the same basis as if you fill a full script. Hopefully this is one that we'll have another shot at next session, as a lot of indicators clearly show and outline the value of getting patients synchronized with their medications, from the ability for you to help them maintain their medications to just saving them time in their very busy lives on filling. There's lots of value to it.
And the pushback on this particular issue came from the payers.
Yeah.
They weren't interested, though there was some sense of agreement. They weren't really interested in paying for partial fills.
And the next one is the naloxone auto-injector. This is one that we again worked a lot on. I took a very early interest on behalf of TPA on working. It started out as a very bad bill, giving physicians the authority to dispense naloxone. Was not the intent of the author or the folks that initially presented it. I worked with them and really parceled it out to where this would give you as a pharmacist the authority to dispense to a third party. This will be outside the normal process of the third party, which generally revolves around you for in-office use. This will give you the ability for a physician to prescribe and for the pharmacist to dispense a prescription to an individual or family member of somebody that may be at risk of a drug overdose. A lot of people often think about those suffering from addiction, but there is also a lot of folks that unfortunately have incidences by taking their normal prescribed medications where they inadvertently overdose. Whether it's taking a pill too soon, there's often transition problems when they're shifting from oral to liquid based, as I've understood. There's a lot of issues that have occurred. This one got a lot more interesting in the past 3 or 4 hours. Realizing that Governor Abbott vetoed House Bill 225, which this bill was actually the second half of. At this time, it's still unknown whether or not it was the first half as to why the governor vetoed it, or it was this portion. So hopefully we'll have some answers very soon. If not, we'll find out when he vetoes it, if he does.
Yeah, there is another. Our bill is still sound, and it's still that one hasn't been vetoed.
Yeah.
But the one that it was placed into was vetoed. And interestingly enough, it's fairly clear that the concern that exists is that this is a tool for individuals who have drug addiction to be able to continue in that path because they've got this crutch that can save their lives here on the side. So I guess the preference is to have people die. So let me just stop there.
Well, and we don't intend to do any disservice to any of the issues coming up. We, of course, are running short on time and want to make sure that we can get to all of them and hopefully give an opportunity if there's a question or two out there to answer. The next one up on the list is discount cards. This was what led by the Federation, really took the lead with the full support of the rest of the pharmacy organizations as well as absolutely TPA on this issue. Very pleased that this made it all the way to the governor's desk. We're very happy because it will make it illegal for folks to inappropriately use these discount cards without you as a pharmacist agreeing to it. No more of they being placed in your contract without your knowledge. You'll have full knowledge that you are participating in these discounts, as well as making it prohibitory for these discount card companies to entice employees. We've heard stories of techs getting money on the back end every time they swiped it for a patient getting a prescription drug-filled. This is a good bill. This is one that was much needed, and we're all very happy to see sitting on the governor's desk, and have heard no indicators as to him not being willing to sign it. MAC pricing. For a lot of y'all, this is constantly a big issue. This is something that the Business Council took the lead on this session. They did a lot of work to help move this ball forward. This is one that will continue to be an issue, I think, down the road. There'll be new tweaks that'll need to be made, but this was a great step that the Business Council helped take the lead on to get done. It's also sitting on the governor's desk. We don't anticipate any opposition on the governor's office, and it'll help improve a lot of things today, and help us also see some future opportunities for improvement. The other one is transaction fees. This was also led by the council, and one that really outlined and showed pharmacy working together, and a lot of the pharmacy organizations played a big role in helping the council with this. It's a good bill. It's much needed. We all know about those PBMs that were skirting the law by changing the names, calling it something other than a transaction fees, but still charging you the fees on the back end. This makes it blatantly illegal for them to charge you a transaction fee no matter what they call it. This will also give the Department of Insurance some teeth to really help go after these folks by being this clear. A lot less ability for them to skirt around it.
Supposedly, it's around $15,000 per pharmacy in terms of what they would save by not having to pay these transaction fees. Second, when you count all the pharmacies, this was a huge hit in terms of the savings to the pharmacy community. And I would echo Justin's comment about congratulating our counterparts in some of the other organizations.
And then
You wanna-
we'll talk about our agency cleanup legislation. This one is pharmacy's normal cleanup bill, but there was a key part in it that I thought y'all should all be aware of. There was a lot of discussion around this. It was a very complicated part of this cleanup bill that had a lot of involvement by folks through the process, but it has to do with the ability of the Board of Pharmacy having access to your financial records. This will take place starting, I believe, in September. This will give the Board of Pharmacy with a specific complaint. They have to have that specific complaint to look. They just can't go on fishing expeditions. But they have to receive a specific complaint. They'll be able to access financial records to examine what is going on. There's a broad array of issues that they needed this ability for that have been proven challenges to the practice of pharmacy. And the benefit I would suggest to folks is it gives pharmacy the opportunity to police themselves before we have courts come into place and start really passing laws and rules without pharmacy having any real control or involvement. Again, it went through a lot of discussion. There was a lot of challenges, but ultimately it came out in a format that it's a very, hopefully, pointed ability, and it's not something that's very broad. But be prepared for that. Ask questions if you have them of the Board of Pharmacy about these rules as they start implementing them and getting them into place.
You'll hear much more about this particular issue because it is a controversial issue, subject to interpretation, and it'll go through the rulemaking process in the agency, in the State Board of Pharmacy, and you will have opportunities to continue to comment on and clean it up so it's not as onerous as it may otherwise be. Kim?
Yeah, the last one we'll talk about, and then we'll open up for questions. The Texas monitoring program that you're all familiar with is going to transition out of DPS into the Texas State Board of Pharmacy. There's going to be a lot of groundwork that needs to be laid and a lot of activities that'll have to happen. So the transition won't actually occur until sometime in 2016, late 2016. But be on the lookout for it. The program's finally going to get to where it should have been all along, to where it's administered by the Pharmacy Board. And it'll bring a lot of benefits to patients, to the pharmacists, etc. One of the things that this also did was that it eliminated the registration fee to register with the monitoring program. So that registration process will disappear, and again, the pharmacy board will administer the program.
Well, and this is one that I feel it's important to compliment, that it wasn't just pharmacy that worked on this. This was an interprofessional endeavor. We had the medical association that really took the lead on this one, worked very closely with TPA and other pharmacy organizations, as well as we had the Texas Association of Business. This got broad support, and all those folks playing a part were very necessary in getting this moved. It's proved challenging in the past, but thankfully it looks like it's going to happen this session. Again, this is another one that's currently sent to the governor as its last status, but no indicators that we're not going to see it get passed.
One final issue that's not on this list, and it's just to make sure that all of you have some level of disappointment at the end. If you recall, 2 sessions ago, we had a new school of pharmacy in Fort Worth. 1 session ago, we had a new school of pharmacy in Tyler. This session, there was additional funds put in place to expand the program in El Paso. So there will be even more graduates coming out, and I'm sure that there are a lot of eye rollings going on, but we will keep you informed on that. As we get to questions, if for some reason you don't have a chance to get a question answered, or you've already fallen asleep, feel free to call us at a different time, and because we're here to serve you. Now we'll open up for questions, either text or online.
Have one here about concealed handgun. If a person has a concealed handgun permit, is there no other permit required for open carry?
No. You're currently licensed as a concealed handgun owner, licensee. You will have that will then expand out into your open carry. What they did is just ultimately struck throughout statute the limitation that the firearm must be concealed. So your concealed handgun license will ultimately now just be a handgun license in the state of Texas, authorizing you to carry. I've got one here. It's a good question. It's asking whether or not pharmacists under a protocol with a physician, a very specific protocol, can still administer immunizations to patients under the age of 7. And the answer to that is yes. There was no changes or impact made towards current protocols. If you have a relationship with a physician that they've authorized you under a protocol to administer it to an individual under the age of 7, or excuse me, actually 14, let me correct myself, under the age of 14, yes, you can still administer that through that protocol. There was no changes to that.
Yeah. I'll take this opportunity to point out the protocol regs that are on the books and have been for, almost 15 years now. Starting to get questions from physicians to pharmacists. Can you help me out on things like Invega? Don't want to do the injections. Can you do the IM and inject these patients with Invega? Yeah, that's all possible under protocol. For that particular physician's patients, yeah, it can be done. Pretty simple process. The rules are quite clear and easy to follow, and if you've got any questions on things like that or other topics where a physician can delegate authorities to you and you're interested in researching that, let us know and we can walk you through the process.
Any other questions? To tag on to what Kim just said, this is an issue that, as you know, we talked about in the statewide protocol, where it would allow a single protocol that might be a pharmacy to physician to be put in place for all pharmacists and all patients. That's still going to be on our table to discuss with our partners in medicine. Again, if you have any questions later, please feel free to call. This particular presentation is going to be archived. It's being taped. And so if you want to be bored again, feel free to to access it. I know that the time probably wasn't the best. There were no good times to do this. So we hope that you've gotten something from this presentation. We will have some of this in writing at conference. And we also will be providing access to this presentation on the web. With that, if there are any other closing comments?
I'm good.
We thank you very, very
Thank you.
much for your time. We thank you very much for your grassroots support. And we ask that you feel comfortable in connecting with us to share the concerns that you may have about these issues or other issues. So until then,
Thank
good night.
y'all.
Thank you.